As the years have passed, the Bremer Group company has seen surgical techniques and hardware improve as new, less invasive techniques come to the forefront in the treatment of the painful spine. These changes have created the need for a new generation of spinal supports, and we feel that our new ComfAlign spinal support answers these needs. Lightweight, molded, gender-specific plastics combined with washable liners and patient-friendly closures make our new ComfAlign spinal support state-of-the-art in spinal bracing. The adjustable fasteners and lordoses make for superior fit and function. Please take a look at our new ComfAlign. Enclosed you'll find our literature, a sizing sheet, and order forms. Once you have read the literature and placed the order for this product, we are sure you will agree this is the best support you have ever seen. Comfort, support, ease of application, inexpensive, adjustable. ComfAlign has it all. The ComfAlign spinal support comes in a variety of sizes to meet your patient's needs. The sizing chart can be found on the back of the order form. Male, small to medium, circumference 30 to 44 inches. Male, large to extra large, circumference 34 to 56 inches. Male, pendulous abdomen, adds 2 inches. Female, small to medium, circumference 28 to 41 inches. Female, large to extra large, circumference 34 to 58 inches. Female, pendulous abdomen, adds 2 inches. Note, there may be times that you have a patient with measurements that fall into both the small and the large range. If the measurement is closer to the lower number in a range, use the smaller size. If the measurement is closer to the higher number in a range, use the larger size. But if in doubt, go up in size. The first step in the fitting process is to measure the patient. Then refer to the sizing on the label. Choose the proper ComfAlign size. To ensure that the correct size is chosen, place the ComfAlign on the patient's back in the proper position and check to be sure there are no gaps or pressure edges around the back of the shell. You should be able to feel the patient's spine through the window in the back shell if the product is properly centered. The back shell of the ComfAlign should be centered on the patient's back and extend from the sacrococcygeal junction to the area of the scapular spines. The lumbar curve of the ComfAlign should align with that of the patient. Remove the front shell by sliding the fastening post out of the keyholes on the left side. Remove the ladder strap assembly by sliding the fastening post out of the keyholes on the right side. Lap the left side over the right side around the patient's abdomen. Place the front shell over the overlapped sides and center at the patient's midline. Mark the location of the front shell on each side by passing a marking pin along the sides of the front shell. Once the sides are marked, put the front shell aside. Remove the ComfAlign from the patient. Shorter patients may require trimming the height of the orthosis using the trim shears provided. Using the marking pin, outline how much is required to be trimmed on the top and bottom of the front and back shells. Trim both front and back shells as outlined, using care not to leave rough edges or irregularities on the trimmed areas. Cut the liner 1 inch longer than the rigid shell if necessary. Without cutting the liner, trim the left side 1 keyhole past the pin mark toward the front edge. When trimming, round the corners of the side to avoid a sharp edge. Also, avoid cutting through any keyhole. Trim the left side of the liner so that it is 1 inch longer than the left side panel. Reattach the front shell to the left side in the keyhole, closest to the pin mark. If the mark is between 2 keyholes, attach the front shell in the keyhole closer to the back shell. Trim the right side and its liner in the same manner as the left. Reattach the lattice straps to the right side 2 keyhole columns closer to the back shell than where the front shell is attached to the left side. Note: a one-hole offset may be necessary to attain a comfortable fit for patients with large hips or pendulous abdomen. The fastening post need not be attached to keyholes directly above or below each other, but the orientation of the fastening posts on each side should be symmetrical. Place the ComfAlign on the patient's back in proper position. Place lattice straps under the guide bars of the ratchet enclosures on the front shell and tighten appropriately. Caution: avoid tightening the straps to the point where the ComfAlign spinal support restricts breathing or causes injury. To remove the ComfAlign, depress the release tab on each of the ratchet closures until it pops. Then depress and hold each release tab and pull the lattice strap free from the fastener. Inserting the lattice strap over the silver guide bar jams the ratcheting device on your ComfAlign orthosis. Do not insert the lattice strap over the silver guide bar. If the lattice strap does become jammed, it can be released by depressing the release tab and fully opening the tightening lever simultaneously. The lattice strap can now be pulled free from the ratchet. Important: if the patient needs more lumbar curve, simply remove the ComfAlign from the patient, access the adjustment screws by lifting the back shell foam liner, and adjust as needed. Keep in mind that excessive lordosis may cause irritation during sitting. Your ComfAlign orthosis is also available with Velcro closures to provide maximum adjustability and compliance. Simply insert the tip of the strap through the chaff and pull to tighten appropriately. Liners are machine washable. Use gentle cycle, mild soap, and tumble dry. No heat. ComfAlign shells may be cleaned with mild soap and water. Dry the shells thoroughly with a towel before reassembling. The ComfAlign spinal support is for single patient use only. We want to thank you for your valuable time and attention. Adjust to a higher compliance, improve the patient's comfort, and increase the simplicity of application. Choose the ComfAlign spinal support. Remember, the Brimmer Group Company, always embracing innovation.